Welcome back. This is the second video for our first class. So let's talk about 10 principles of CBT. Most importantly, CBT is based on ever-evolving formulation of client issues in cognitive terms. So this is in line with what we talked about the cognitive model. Whatever presenting symptoms that your clients bring in, we focus on the cognitive dimension, and we try to look at their thinking patterns that may be contributing to maintaining their problems. So we're going to conceptualize your client case based on cognitive terms, and this conceptualization is going to evolve throughout the entire therapy phases. And this is because, when your clients come in, the information that they share with you might not be enough for you to be able to draw the complete picture of what's really going on. As you get to know your client, you may hear some stories that your client have been withholding, or you may develop more understanding of how client clinical symptoms are manifested, because their story might be very much shaped based on their perception that's influenced by their clinical symptoms. So as you get to know your client, it's likely that the cognitive conceptualization is going to change. Secondly, CBT is built upon a sound therapeutic alliance. And of course, this is not just true to just CBT, but because CBT really requires very active participation of clients, therapeutic alliance is particularly important in CBT. So it's important that you're able to demonstrate good counseling skills and develop accurate understanding of what's going on in your client's life. So the rule of thumb is to start with the person-centered approach that's developed by Carl Rogers. You just want to be a nice human being in the room with the client, and you want to treat your client the way that you would like to be treated. If you're a client and you want to accept the clients are difficult, that's why they're there. And this kind of perspective would actually help you be a lot more patient, empathetic toward your clients, and also helping clients feel safe with you so that they can share things that are difficult to share with other people. There are some other strategies, such as emphasizing the positives by asking questions like, what are some of your strengths and positive qualities, and pinpointing some of the good things that your clients shared. I think it's great that you did, or what does it say about you that you got this job in the bookstore? The reason why this is very important is that, when I was talking about the cognitive model, I mentioned the negative triad of depression. People who are depressed generally have very negative views about themselves and other people and the world. They sort of have this mental filter so that they can't really attend to some positive things about themselves or things that are happening in their lives. So by really pinpointing these positive things, you could actually model the way of thinking that really contributes to better mental health for your clients. Also, showing genuine interest about your clients, when it's appropriate, using self-disclosure. All these things will help you develop a solid therapeutic alliance. I'm going to skip this next slide because a lot of things that I list there overlap with some of the other principles that I'm going to be talking about, but just read through your handout. So next principle is that CBT emphasizes collaboration and active participation. So this is called as collaborative empiricism, which is a systematic process of therapists and patient working together to establish common goals in treatment. So for CBT, you are just there to guide your clients, but it's most of the work that it's actually clients themselves have to do. A lot of skills that you teach in therapy session is expected to be transferred outside the therapy, so that your clients become their own therapists. Next principle is that CBT is goal-oriented and problem-focused. I mentioned that CBT tends to be brief, so you have specific goals that you want to accomplish within this limited time frame, and that's why you tend to be problem-focused. So problem-focused, seems like it's really against the general approach in social work, because you want to be really strength-based. But there are ways that you can be focusing on problem, but still very client-centered, because your clients come in because they're suffering. Their clinical conditions create all kinds of problems that's very painful for them. So they have specific problems that they want to solve, and that's why they're there to work with you. So by really focusing on helping your clients to solve those problems, you're actually really focusing on your client's need. Next principle is that CBT emphasizes the present. That's kind of in general. So CBT is always here and now. We'll talk a little more about how we can actually focus on the past at specific time, specific like phases of therapy, when we deal with core beliefs that your clients have. You'll learn more about different types of thoughts that we're going to target in CBT, such as automatic thoughts or core beliefs. We believe that your clients develop a certain way of thinking about certain situation because there is this kind of fundamental view that they hold about themselves and about the world. And then typically those core beliefs are developed based on their early childhood experience. So there are specific times that we will actually focus on the past to address some of these core beliefs that really interfere with their daily functioning. But other than that, we'll mostly focus on present times, because the rationale is that you don't really necessarily have to go back to the past to fix what you are doing right now. There are behavioral principles. There are ways that we could just change the way you think about things here and now, and that will actually help you to address the problems that you're dealing with. So that's very different approach from the psychodynamic approach, where you are actually revisiting some of the early childhood experience that's often traumatic, and clients are encouraged to reshape their past experience so that they become a different person. Another CBT principle is that CBT is educative. I already talked about this. CBT really aims to teach clients to be their own therapist. So skills and techniques, the clients are encouraged to practice those outside of therapy through homework. And then CBT always emphasizes relapse prevention. They can always come back to therapy when they need more support, but the idea is that you equip your clients with all these skills, knowledge, and techniques so that they can manage their own symptom using those coping skills that they develop with you. Next principle is that CBT is time limited. We already talked about that. In general, those with depression, anxiety, generally 6 to 14 sessions are suggested that it's enough. And also those who are addressing traumatic experience in general, like, for example, TFCBT, in general, that's about 6 months. Those with personality traits would actually stay longer, up to 1 to 2 years. These are just general guidelines, but of course, your therapy has to be individualized. So it depends a lot on your client's past psychiatric history and their treatment history and the kind of environment that they are in. So these, just keep in mind that these are just general suggestions. Another principle is that CBT is structured. We'll actually spend some time to learn about different phases of therapy, starting from the beginning and middle and the final phase of therapy. Also, like within each session, including evaluation session, first CBT session, second session and beyond, there are ways that you can structure your session so that you can address all the things that you need to address. Next principle is that CBT teaches client to identify, evaluate, respond to their dysfunctional thoughts and beliefs. You already talked about that. The CBT is based on the cognitive model, and you want to articulate the rationale why you want to look at your thinking pattern. You want to teach skills for your clients to be able to identify and evaluate and change the way they think about things. And lastly, CBT uses a variety of techniques to change thinking, mood, and behavior. So although CBT has a very specific skills and techniques that are cognitive, focused on cognitive dimension, a lot of CBT therapists would incorporate other skills such as like a psychodynamically inspired techniques, mindfulness techniques. So we will dedicate one class to talk about some other techniques that you can incorporate into CBT session. So these are the nature of CBT approach, and based on that, you can kind of think about what would be ideal type of client population that could best benefit from CBT. Typically those who can access thoughts and feelings, those who can accept some responsibility for change, understanding a CBT rationale and basic formulation, those who are able to form a good enough relationship with therapists and have a degree of optimism would be a good candidate for CBT. And typically those with impaired cognitive functioning, those who are currently in crisis, those who are unwilling to let go of avoidance behaviors, those who have pessimism about therapy is less likely to benefit from CBT. But of course, there are a lot of efforts that have been made to adapt CBT techniques to work with these type of clients. For example, clients with developmental disabilities, intellectual disabilities, those with limited cognitive functioning. And in reality, a lot of your clients will constantly be in crisis mode. So it's hard to kind of not to work with those who are in crisis mode. I've known a lot of clients, I mean, not just clients, but a lot of us, we are pretty stubborn about sticking to our old ways of doing things, old ways of thinking about things. And I've never seen any clients who come in like really being excited about being in therapy. So although there are client groups that are less likely to benefit from CBT, with the right kind of accommodation, we can help your clients to really get the best out of CBT. There was an article about, like therapists who likely would be very ineffective in applying CBT. It's a kind of funny list. You can kind of go through that yourself. I kind of see like a couple of things that I can pinpoint. Therapists do not want to spend much effort thinking, that's kind of obvious. I think that's part of the reason why I like CBT so much, because I like thinking. Like I habitually like engage in thinking about things. I constantly think, like I like thinking about thinking. So there's a lot of like cognitive work that's kind of put into CBT process. And those who are not scientific minded, like CBT is based on very clear theory of change, and then uses a lot of science-based techniques. So you're likely to really get the best out of CBT by applying the protocols in the correct way. So those who are not really, keen on like learning about like protocols, the right ways to apply things, are less likely to be effective in applying CBT. So I want you to go through this list and then, reflect upon like your trait and think about like whether you think you would be suitable for CBT. What are some of the traits that would make it difficult for you to apply CBT? And hopefully we'll have some time to share those things when we come back for our in-person portion of a class next week. So that was it.